Hi, my name is Olga. I'm from Nightingale College. I'm going to be presenting the intradermal injection video. I have my appropriate supplies here. I have my clean gloves. I have my medication. I have my cotton swabs and my alcohol wipes. And also I have my syringe and needle here, which is supposed to be for this injection, supposed to be 29 to 30 inches. And then half needle, also milliliters, what I meant to say. And it's going to be uh, one milliliter syringe. But for this video, this is all that we had in our supplies. This is the one I'm going to be using today. Next, I will be providing you the 6 medication rights. So it's going to be right patient, right drug, right dose, right time, right route, and right documentation. Before I do anything else, I want to confirm I'm going to check in the ER the first time to make sure that I have the right medication, which is the tuberculin purified pyridine. I'm going to check, confirm, and I will go over the calculations for this medication, which is 0.1 milliliters per intradermal. This paper right here, and there's nothing in the back. Okay. So I will gather all my supplies. I will enter the patient's room. I'm going to close the door for privacy, and I will place my things on a clean, dry surface. And I'm going to introduce myself to the patient. Hi, Ms. Smith. My name is Olga. I'm going to be your nurse today. Can you please identify your first name and your date of birth? Okay, perfect. That's my 2 identifications. All right, Ms. Smith, do you have any allergies? Do you have any seasonal allergies, any medication allergies, or any food allergies? No? Okay, perfect. So today your doctor has prescribed you an injection. This is a PPD. This is used to test to see if your body is immune to tuberculosis or if you're infected with it. We will inject a little bubble underneath your skin, and we will have you come back within 72 hours to check and test. Do you have any questions for me? No? Okay, so before I ask you if you have any more questions, I want to tell you a little bit about the medication further. So it is used, like as I mentioned, to test to see if your body is immune to tuberculosis. This is called a PPD test. The use for it is to inject to see if your body is immune. Some of the side effects that you might be experiencing would be slightly burning, slightly stinging, maybe some numbness in your hand, or slightly burning. An adverse reaction would be if you have like blurry vision, if you have like numbness in your arm, if you have any vomiting, please let us know so we can notify your provider as soon as possible, okay? Now, do you have any questions for me? Okay, perfect. So you have done a PPD test before? All right, yeah, that's good. Okay, so after that, I am going to get ready. So I will wash my hands and I will apply my clean gloves. So I have all my stuff here. I will check in the ER again to identify the right dose. That's the second time. And I will pull out my syringe here. I will grab my needle syringe like a pencil, and we are going to inject 0.1 milliliters of air. So we're going to use that. So we're going to go 0.1 of air, and we're 0.1. Perfect. And before I do all that, I will make sure that I wipe, take off my cap, wipe it, let it dry, air dry, apply that to 0.1. I'll show it again. Okay. And I will remove my cap off the syringe. And I will inject in the valve, make sure I don't touch the medication. I will squeeze back the air into the bottle, and I will slowly raise it up, and I will make sure that I put in 0.1 milliliters. I will tap to make sure that there's no bubbles. All right, take it out. And I will do the one-step method. Put it in the cap here. Perfect. Put it on. Discard. All right, now that is ready. Next, I'm going to locate the patient's area where I'm going to inject. So I'm going to place my 2 fingers where the appropriate wrist is, and my 2 fingers by the other side, which is where the elbow is, the interbutyral area. I will look, and I'm gonna make sure that I inspect the area, no lesions, no discoloration, and I'm gonna palpate to make sure that there's no tenderness. There's no tenderness. Feeling any tenderness, Miss Smith? No? Okay, perfect. So next, I'm going to open up my alcohol wipe, and I will start in the middle, going towards outwards, 2 to 5 milliliters. All right, I'm gonna discard, and I'm gonna let it air dry. Okay, next we're gonna start the injection. Miss Smith, I wanna make sure that you are aware that there is going to be a little poke, and you're gonna feel a little burniness with the injection. Do you have any questions? No? Okay, you've done this before. Okay, perfect. So I'm going to take my non-dominant hand, and with my 2 fingers and my thumb, I'm going to pull down on the skin, take off the needle, pull down on the skin, at 5 to 15 degree angle. I will go in 3 milliliters deep inside the skin. Here's the poke. And slowly I will inject the medication, and I'm starting to see a mosquito bite. It is about 6 to 10 milliliters. I am going to release, and I will put the gauze. I'm going to discard my needle into the Sharps biohazard container, and I will throw this away. I will apply Band-Aid if needed, and I will not recap this, and I'm going to discard everything. and I will make sure that my patient is feeling good. You're okay. Do you have any questions? Do you have any pain? Okay, perfect. I will discard my gloves. I will wash my hands, and I will go ahead and document my procedure.